Welcome back. The Ritshidze Project survey on more than 9,000 people has found that many HIV-positive people no longer go to the clinic. Most of them have pointed to unfriendly service as the main reason, and there are other population groups as well that are finding these public facilities not to be friendly. To unpack some of the key findings, we're joined by James Oladipo, who is the Ritshidze Project researcher. James, thank you for making time for us. Good afternoon. When people visit any health facility, whether it's private or it's public, they want friendly service, right? They want safety, they want privacy. But this is not always the case for some populations, is it? What is driving people not to use public facilities in the country?
Thank you so much, Clement, for having me, and good afternoon to your viewers. So this particular report focuses on key population, and when we say key population, we're talking about people who use drugs, we're talking about sex workers, we're talking about members of the LGBTQIA+ community. And as you've mentioned earlier, we spoke to over 9,000 people across key population across the country, across 7 provinces and 21 districts. And some of the reasons they were mentioning as reasons why they refused to go to the clinic, whereby we found out 12% of those that we actually spoke to do not receive healthcare services anywhere. And it was lack of privacy, unfriendly staff attitude, and sometimes being denied and ridiculed in front of other healthcare workers. So those are some of the reasons why why key populations have disengaged from care and stopped taking treatment.
So which groups in the community so you've mentioned that you've looked at the sex workers, you've looked at, I suppose, members of the LGBTQI+ community. What are some of the privacy violations people are subjected to? We've heard, shocking stories before of how staff in clinics or hospitals will disclose some people's HIV status in front of other patients.
Yes, absolutely. So one of that is people's HIV status is being disclosed in the waiting area in front of other healthcare users, and also the fact that people use drugs or that they engage in sex work are also some of the privacy violations that people have to be subjected to. And even the fact that sometimes there are issues around gender identity, the kind of STI that someone has come to the clinic to get help for. Those are some of the kind of issues. And yes, you might want to wonder, how do they know that someone uses drugs, or how do they know that someone is a sex worker? It's because sometimes, because of the specialized services that some of these key populations require, they are forced to disclose that they use drugs, or that they are a sex worker, or that they are a trans person, because at that point, staff members are being known to invite other staff members into the consultation room to laugh at the person's symptoms, to laugh at the fact that the person uses drugs. We've had people who use drugs telling us about how they are chased out of the facility because they said they smell, they said they might steal from other patients. We've had security guards asking trans people that they are confused about their gender. Are you a man or a woman? People's pronouns not being respected. So there's a wide range of issues that members of the key population have to face in clinics.
Yeah, and I imagine some people are being misgendered too. What's often the reaction from some of these people? Because also there's the experience of drug users, right, as well.
Yes, so a lot of the times when people, we've spoken to key populations that have now decided not to go to the public health facility anymore. They decide those that can afford to use private clinics or private doctors are able to use that. Those that are closer to drop-in centers or mobile clinics are able to use that, but not everyone is very fortunate. So a lot of people are they decided to disengage from care because they can't continue to deal with the attitude in the clinic and being chased away and being denied services. we've had issues whereby sex workers go for STI treatment and the nurses, the healthcare practitioner are asking them to go bring their partners. So they are forced to tell them, I'm a sex worker, I don't have a partner. And then the preaching starts. They start to tell them about how what they are doing is an embarrassment to themselves, to their family. So there's a whole lot of issues that people they get to the limit, and they either have to continue facing those situations or experiences, or just disengage from care.
Yeah. What are some of the consequences of this kind of behavior from the staff members at these public health facilities? Because at the end of the day, you keep away these population groups in society, and they need care too. It's quite critical for them. So what are the consequences when they decide, I'm not going to that public facility because I'm not happy with the treatment I receive?
Thank you so much, Clement. So key populations are at higher risk of HIV, of contracting HIV. And if we as a country, if we want to reach the 95 goal of getting everyone on treatment, ensuring that everyone gets tested, everyone gets on treatment and stay on treatment and get to viral suppression, then we would need to ensure that no one is left behind, especially the key population that are higher risk. So with the more key population staying away from the clinics, not accessing HIV prevention services, we are not even talking about the fact that some of these prevention services are not even available, are not being offered to them. But them staying away and disengaging means that there's more higher risk of HIV contraction, of the spread of HIV, and the fact that as a country, in the fight against HIV, we are not able to reach those targets. We are not able to ensure that we get enough people onto treatment and get enough people to stay on treatment, because South Africa has the highest number of people who would go onto treatment but also fall off. And across, not even just with the key population, with the general population as well, staff attitude is one of the reasons why people disengage from care.
Yeah. I've often heard about, drop-in centers. What about those? Are they better? Are they an option?
Yes, yet again in our reports, the findings show that the attitude in drop-in centers and mobile clinics are much better. But the downside is majority, over 79% of those we spoke to, use public health facility because they don't know about drop-in centers, or the drop-in centers are too far from them and they don't have the transportation to get there. So the attitude, the service at the drop-in centers and mobile clinics are much better, and key populations are able to access the specialized services for people that use drugs. There's harm reduction services. For trans people, there's hormone therapy. For sex workers, there's friendly HIV testing, there's gender-based violence services. But the problem is there are not just enough of this drop-in centers. So amongst our recommendations, one of them was we call on the government, we call on the Department of Health to establish at least two key population specialized clinics per district, so that at least every key population know that there is a clinic around that they can go to, where they will receive friendly service in a safe environment and be able to access everything that they require as a key population.
Yeah. What else can the Department of Health do? How can they intervene? Because, some population groups have been denied entry even to these public health facilities. And I hear what you say about maybe ensuring that there's just more than one facility in one district. But the reality is it's not just the capacity we need to work on. What's the point of having more and more capacity, right? We've got more facilities, but the people in society as well, are still not giving a friendly service to these vulnerable groups.
Absolutely. Yeah. So we have also asked for sensitization training across the country in all healthcare facilities, and to ensure that they involve key populations in this training as well, and also to ensure that whichever healthcare practitioner denies services or to key population, they face disciplinary actions. And we will continue to monitor this. We've given timelines for for these trainings to happen between the National Department of Health and PEPFAR to ensure that healthcare workers, including security guards, because our findings have shown that security guards come in next after healthcare practitioners as the most unfriendly and non-professional to key population, so that this training happen, and also to design posters so that for the general healthcare, for clinics to become a safe space, for this to also be a way whereby other healthcare users know that there are key populations in this clinic. This is a safe space where everyone is welcome, where no one feels discriminated against, and where no one is denied services because of who they are or because they are a key population.
Yeah. James Oladipo, thank you for joining us for this important conversation. James is with the Ritshidze Project. He's a Ritshidze Project researcher. Thank you.